Hello, welcome to this month's Fit for Colorado Talk to the Doc chat. I'm CBS 4 anchor and health reporter Kathy Walsh. For the next half hour, we'll be chatting about fitness and health issues here on CBS4Denver.com. Throughout this chat, we encourage you to ask questions by simply typing them in the chat window at right, and we will do our best to answer those questions. In today's chat, we're going to discuss heart health. This month is American Heart Month. Each year in the United States, over 1 million people have a heart attack. About half of them die. In fact, coronary heart disease is the #1 cause of death in this country. Joining me today is Dr. Jerry Greenberg, cardiologist with the Medical Center of Aurora, and Dr. Jim Hill, co-founder of America on the Move and director of the Center for Human Nutrition, UC Denver. Okay, Dr. Greenberg, let's talk about the most common types of heart disease. We've got a list here. Tell me if we're right on these, and you can explain what each of them are. You want to start with the first one, coronary artery disease. Explain that, please.
Well, coronary artery disease is the bread and butter of what most cardiologists do today in America. Cardiovascular disease in America is the leading cause of death. It outranks all of the other diseases. Luckily, with good intervention and primary care, this is going down, but it is the bread and butter. It's what causes heart attacks. It's what causes acute coronary syndrome. It causes sudden cardiac death and the end-stage congestive heart failure.
Now, what is it specifically? Is it when you get the plaque buildup? Is that what it is?
Well, the bread and butter coronary artery disease, I don't know if you want to look at this model,
sure.
is that the heart has a plumbing system, and on the surface of the heart are these red structures called the coronary arteries. The blue structures are the veins, but what occurs is when the heart pumps blood out into the aorta, the main blood vessel, some of that blood supply is then returned to the heart muscle itself to keep the heart muscle alive and well through these tubes called the coronary arteries. There are essentially two, the left and the right coronary artery, and as you can see, each one of these have various branches which are located off of the main trunks. Atherosclerosis develops as we all age, where these little tiny arteries get plugged up. Okay, there are two. Blood travels down here, keeps the heart muscle perfused, and if a blockage forms, it can cause all the various manifestations of coronary heart disease, which can be heart attack, chest pain, unstable angina, a whole host of things.
Okay, we have a couple of other things that are also heart failure, I know, is another type of heart disease, and what is that?
Heart failure is just a combined group of combined term that we use for when the heart muscle itself, which is normally a healthy pump, begins to fail. The amount of blood that is ejected out of the heart is not enough to meet the metabolic demands of the body.
Okay.
And that sets a whole cascade of events. People can't do as much, they retain water, they get shorter breath, they can't lie flat in bed, and it's basically the end of the line. It's what we want to try and prevent. We want to keep the heart alive, healthy, with the least amount of damage done to it.
And then what are heart arrhythmias? I saw that that's another one.
Heart arrhythmias is not my area of expertise, but we have our electrophysiology colleagues, and the heart has a normal sync, a normal beat. And because when the heart gets damaged, it can set up for a whole host of what we call arrhythmias, ranging from atrial fibrillation to ventricular tachycardia. Some of these are innocent, and some of them are very, very dangerous that need to be approached.
Okay, it seems like when we talk about heart disease, most people get very concerned and fearful of what we call heart attack. What are the risk factors? So I understand that there's a whole list of them.
There are major and minor risk factors, and the major ones, I don't know if you want to address, but smoking.
Got some right here. Family history or hereditary.
Hereditary. That's the one you really can't change. You can't change your parents. Smoking, hypertension, and diabetes are big issues that we can make some difference in with time, with primary prevention.
And Jim, I see on that one, high cholesterol. Right up your alley.
And I think obesity, too. I mean, all these are related. As you become obese, you have problems with blood pressure, cholesterol, you tend to develop diabetes. I think one of the big things here is it is hereditary, but regardless of your genes, which you can't do anything about, you can do something about your lifestyle.
Absolutely. I mean, we can change 4 out of those 5. That's a big hit.
So even if you're at very high risk, you don't have to sit back and accept that. There are some things you can do, and probably if you have a family history, you should even be more worried about those risk factors.
Well, that's what we see in our office a lot, is somebody who said, hey, my dad had a heart attack at 52, I'm in my 40s, what can I do to maybe make sure that I don't go on to live in his life path?
So what do you tell him?
I tell them you can't change your parents, but there's a lot you can do, and you know it's all about risk factor modification. Okay, if they're smoking, if they're sedentary, if they're obese, we have a lot of things that we can change. Obviously, the first things we look at are their lifestyle, and we like to see what their cholesterol is and make sure that their hypertension is well controlled. So all of these things, their primary care physician should also be looking out for that patient and getting all of these factors under control.
And then as tools, you have medications and lifestyle available to both
Oh,
use.
yeah, if you want to talk about primary prevention that we have, there are many, many tools that we look at. I mean, some of the basics are your cholesterol level, your blood pressure. Do you have diabetes? Are you participating in an exercise program?